Hello, welcome to Habersham Health. My name is Jacob Byrne, the creator of the site, and I'm here today to walk through some of the features that we've built into the website. First, what is Habersham Health? Well, when we started, we wanted to take all the available data that's out there for healthcare and put it in a new format that's easier to understand and easier to view. On Habersham Health, we score hospitals based off 4 criteria: quality, satisfaction, provider experience, and price. The first 2 are hospital level. This means that the quality and satisfaction score are going to be the same for the hospital no matter what operation or procedure is being done. These are all taken from Medicare collected data sets that are available online but are a little bit harder to find. On Habersham Health, for quality, we look at 21 different metrics such as, are antibiotics given at the right time, for what percentage of patients are catheters removed timely, and also what are the readmission rates for specific diagnoses. For satisfaction, we look to answers from hospital-administered surveys talking about patient satisfaction. Questions on these are, how well do doctors and nurses communicate? Is the area around you clean, quiet at night? Would you recommend the hospital to your friends? These are the things we look for in quality and satisfaction. Now, for provider experience and price, these are at the procedure level. So if a hospital performs 100 different procedures, they'll have 100 different scores for experience and price, and it's based on each specific procedure. When you get to the website, there are 2 main functionalities. The first is to search by common procedures, and these are the top 100 procedures that were performed on Medicare patients in the year 2011. Or to search by hospitals, and these are more than 3,000 hospitals across the United States. When you click on the Procedure tab, you'll see 4 choices right away: joint replacement, spinal fusions, COPD or emphysema, and also pneumonia. These are all high-volume cases across the country, and they give the consumer the right to choose which hospital they're going to go to. While they are pressing medical emergencies, they're not so urgent that it's life or death, and the patient will be able to spend a few minutes looking what's close by, who has experience in this, and who provides the best value and quality. Now, if you're not looking for those 4 procedures, you can also click the Other button. That will bring up all the other procedures in the top 100 and will show all of them based off the affected area. And this is supposed to be in layman's terms, so something that's very easy for the average consumer to understand. What you'll see, though, is that the same procedure may be listed 2 or even 3 times. This is because Medicare has grouped all of the procedures into levels of severity. So a stay that requires more time or more resources for the hospital could be grouped, instead of a level 1, which is the lowest level, as level 2 or level 3, which would be the highest level. The second way to use Habersham Health is to compare hospitals. From the home page, you can either use the Jump To buttons to choose an area, or you can move the map. When you see all of the hospitals in your area on Habersham Health, you'll be able to view different metrics at the hospital level. However, if you want to get more detail, click on the link for the hospital. This will then show all of the data available on Habersham Health, including the satisfaction and quality score on the right-hand side, and all of the common procedures that are part of the Medicare data released for 2011. Habersham Health is designed for use by patients. If you know you need a procedure in the next few months, it's a great place to start doing research to understand which providers, locally or nationally, have the most experience, have the best quality and satisfaction scores, but are also priced competitively in the marketplace. However, this can also be a useful tool for clinicians or hospital staff. After speaking with a few doctors and showing them the site, they immediately jump to the quality section to see where is their hospital falling behind. The site is very easy to use because it compares the hospital score to the top 10%, the top decile, and also the median score, or the top 50th percentile. The final thing I'd like to talk about is what's next for Habersham Health. While I think we have a very useful platform, it is still just that, a platform. We'd like to build on top of that to allow patients to compare side by side hospitals either in their area or nationally. Additionally, we'd like users to have profiles so they'd be able to rate their experience. Thank you so much for your time. I'm excited about the future of Habersham Health.